Major League Baseball has declared June 2nd Lou Gehrig Day, a new event that the Colorado Rockies will be participating in to raise funds for ALS. I'm with CU Medicine neurologist Dr. Laura Foster to talk more about ALS. So first, for those that don't know or think that they do, what is ALS?
ALS is a motor neuron disease, and that means that it affects the nerves that communicate with the muscles and help a person move. And what usually happens is that a person develops weakness in an arm or a leg that gradually gets worse and worse over a period of months. And it also affects the nerves that go to the throat and to the voice. So it causes speech and swallowing problems. And ultimately, it causes breathing problems as well.
Can you talk a little bit about what causes ALS? Is there a way to prevent it?
Good question. So we know that about 10% of ALS it has genetic causes, and we're identifying more and more and trying to understand those pathways. But we don't know the ins and outs of exactly what causes it. We're still trying to learn that with research. There's no way to prevent ALS.
So without any way to prevent it, what is the treatment for ALS like? What is the life expectancy if someone does get it?
So, the treatment for ALS is two main things. One is there are a couple medications that have been shown to help slow the disease process down. So, we use those two medicines. And then the other main thing that we do is help support people as they get weaker. And so, for example, we use ankle foot orthoses or braces that put in people's shoes in order to help them walk more easily. We have additional supports of wheelchairs when people are no longer able to walk. And we also help people with things like feeding tubes when the swallowing gets harder, and with ventilators or breathing machines when people's breathing is harder. Average survival for people with ALS is on the order of 2 to 5 years from when they first get symptoms to when they die of respiratory failure.
Well, Major League Baseball has declared June 2nd again to be Lou Gehrig's Day. A few years ago, many remember the Ice Bucket Challenge. I think it was a while ago now. But why is ALS awareness so important?
ALS awareness is important because it can help patients with ALS. I think there are two main ways it can help people. And one is to promote research and understanding ALS better and developing better treatments. And so, in order for the funding sources to sponsor programs that help ALS patients, we need more awareness. We need more time in the spotlight. And I think the second main reason is to help patients who have ALS get the support that they deserve. So I think it's kind of I would compare it to cancer in some ways, as far as once a person has a bad cancer diagnosis, then insurance companies are usually quite understanding of that and provide appropriate support. And I think that ALS is just a little bit less understood. And so we spend a fair amount of time trying to advocate for patients with insurance companies. And I think if it were better understood, we would have better access for patients to those resources that help people, like wheelchairs or home health care, in order to take better care of them.
Talking about you as a provider, why did you want to be a neurologist?
So I went into medicine to help people, and I think that neurology is interesting because it still depends so heavily on patients telling their history and on doing an exam in order to get the right diagnosis and establish treatment. It's not something that can be figured out by just looking at a lab or a scan. So I really appreciate how much one-on-one time there is in order to treat patients appropriately.
What is your approach to patient care?
So I think of the Hippocrates quote of cure sometimes, treat often, and comfort always, especially as it relates to ALS, because there isn't a cure yet. And I hope there will be soon, and that's what we're working towards. But I really have as a philosophy to help people, even if it's making just one day at a time a little bit better. And so figuring out what are the things that are bothering a patient the most and focusing on those in order to help people have a better quality of life.